In this video, we discuss melatonin as a sleep aid and take a look at its indications and safety. Join me. Melatonin is a naturally occurring hormone that plays a central role in the control of circadian rhythms and in the body's adaptation to the light-dark cycle. Circadian rhythms are physical, mental, and behavioral changes that follow a 24-hour cycle. They control our needs for sleep, our blood pressures, and our body temperatures over a 24-hour period. Until the 1960s, it was believed that melatonin was produced exclusively in the pineal gland in the brain. However, we now know that it is produced in other organs and tissues in the body, such as the eye, the bone marrow, and the skin. The hormone directs a part of the brain known as the suprachiasmatic nucleus, which acts as a central pacemaker. The suprachiasmatic nucleus directs other circadian clocks throughout the body, so that at night we have the urge to sleep and our blood pressures and body temperatures decrease, and during the day we are awake and our blood pressures and body temperatures are higher. Melatonin levels rise progressively during childhood and are at their highest between the ages of 8 and 10. From about age 40 to 45, they begin to fall progressively, so that by the time we are 70, they're 10% of what they were pre-puberty. The hormone is secreted in response to darkness between the hours of 8 and 10 p.m. every day. The levels of the hormone are at their highest between midnight and 3 a.m. After that, they fall progressively and remain very low during the day. Exposure to daylight is the chief suppressor of melatonin secretion, and the effect of daylight on melatonin secretion depends on the timing, the duration, the intensity, and the wavelength of the light. Artificial light can also affect the secretion of melatonin, and exposure to artificial light between the hours of midnight and 4 a.m. will inhibit melatonin secretion. Several studies suggest that melatonin may have a positive impact on sleep disorders in conditions such as Alzheimer's disease and Parkinson's disease, and in children with psychiatric sleep disorders, such as children with the Autism spectrum disorders. In blind patients with free-running circadian rhythms, or in patients with delayed sleep phase syndrome, conditions in which the sleep-wake cycle is not synchronized with the light-dark cycle of the day, melatonin was found to be effective in correcting the phase shift underlying these conditions. Melatonin is usually prescribed in doses ranging from 1 to 5 milligrams and is usually taken with food 1 to 2 hours before the desired bedtime. A 2 milligram prolonged release preparation, approved by the European Medicines Agency in 2007, is indicated for persons 55 and over for the treatment of primary insomnia for up to 13 weeks. In the US, the American Academy of Sleep Medicine recommends melatonin for children and adolescents with neurologic conditions and irregular sleep-wake rhythm disorders. However, they suggest avoidance of melatonin in elderly patients with dementia. On rare occasions, serious side effects can occur, and these include chest pain, fainting, and changes on the blood count. Unlike other sleep medications, melatonin does not cause dependence nor increase the risk of falls. Women who are pregnant or who are breastfeeding should not take melatonin. In general, short-term use of melatonin for the treatment of insomnia and other sleep disorders appears to be safe for most people. However, more information is needed on its long-term safety. Thank you for watching. If you found the video helpful, like, share with friends and family, and leave your comments in the space below. And support this channel by subscribing. Until we meet again, stay healthy and stay safe.